Hi, hello. So in the past few months, I've actually been a lot more vocal on social media talking about endo, and it's led to quite a few people messaging me and asking, what is it, how does it work? So March is actually Endometriosis Awareness Month, and because of that, I thought I'd make this little video and explain it. So endo is often called the invisible illness, because you can't see it from the outside. So you look at me right now, I don't look sick, I look fine. But I actually started to flare up this morning, and internally I am very not fine. Endo is ranked in the top 20 most painful conditions per the National Health Service, and it's estimated that 176 million people worldwide suffer with endo. To put this into perspective, it's basically as common as diabetes. Yet per the National Institute of Health, diabetes research in the US alone receives $1.1 billion in funding, which averages to about $38 per person with diabetes. Yet endo research only receives $10 million, which averages to 64 cents per person. So endometriosis is a condition that occurs when tissue that's somewhat similar to the kind that lines the inside of the uterus, called the endometrium, grows outside of the uterus in areas where it doesn't belong. So during a regular menstrual cycle, the ovaries produce hormones that stimulate the lining of the uterus to thicken in anticipation of a fertilized egg. If there is no fertilized egg, the uterus sheds the lining, resulting in the menstrual period. With endometriosis, the tissue that grows outside of your uterus also responds to these hormones, so it thickens, breaks down, and sheds with the cycle. But because it has no way to exit the body, it becomes trapped, and it creates an inflammatory response and causes pain. Endo can also cause what's called adhesions, which are bands of scar tissue that can literally fuse your organs together. So endo tissue can also gather on the ovary and create what's called an endometrioma, or a chocolate cyst. But don't let that name fool you, they're not filled with chocolatey goodness. They contain old dark blood and shed tissue. When these endometriomas get too big, they'll rupture and they'll spill their contents, causing even more pain and inflammation. Endometrioma cells tend to develop mutations in certain genes, and these mutations can lead to an increased risk in developing ovarian carcinomas. So where in the body is endo found? It's most commonly found in the reproductive system, particularly the uterus, vagina, cervix, ovaries, fallopian tubes, outside the uterus, and the pelvic cavity in general. But it has reportedly been found everywhere except the spleen. Yes, everywhere. So the pancreas, heart, brain, lungs, kidneys, bladder, intestines, colon, rectum, appendix, the liver, and almost anywhere else you can think of. So what are some of the symptoms of endo? Some of the most common symptoms include an intense debilitating pelvic pain, painful periods, excessive bleeding, chronic fatigue, pain during sex, back aches, hip and leg pain, abdominal bloating, which is also called endobelly, constipation, diarrhea, nausea, headaches, migraines, problems with urination, and infertility. It's important to note that a lot of these symptoms will get worse on the menstrual period, however, they can happen at any point in the cycle. So as I just said, endo affects fertility. It's believed that 33 to 50% of endo sufferers have difficulties getting pregnant. The exact link to infertility is unclear, but there is a belief that the inflammation can cause damage and scar reproductive structures, which potentially inhibits either the release of the egg or its movement. There's also the theory that damage to the uterus can make implantation of a fertilized egg difficult. So endometriosis is ranked in stages, and it goes from stage 1 to stage 4. So difference in between the stages is that as you work your way up, there are more lesions, they're bigger, they're more deeply infiltrating, and there's an increased presence of cysts and adhesions. However, it's important to keep in mind that the stage of endo does not correlate to the level of pain someone is experiencing. What this means in reality is you can have someone with stage 1 experiencing more pain than someone with stage 4. There's also some important risk factors to consider with endo. So endo can occur to anyone who has a uterus, including transgender people. Also, you're at a 2 to 3 times higher risk if a close relative has endo. Then there are 3 other central risk factors, and that's if you haven't been pregnant before, if you started your period pretty young, and going through late menopause. So how do we fix endometriosis? Unfortunately, there isn't a cure for endo. So basically, your options are limited to symptom management. So that includes pain management through things either like medication, or some people benefit through diet changes, and also hormone therapy, so things like contraceptives, such as a birth control pill or an intrauterine device. There's an old myth that pregnancy or a hysterectomy, which is removal of the uterus, would cure endo, but neither of those are true. So there's two main types of surgeries that you can get with endometriosis. The first is called ablation, and that's when a surgeon uses a laser to burn off the lesions. However, this method decreases the chances of removing the lesions completely, as it doesn't typically get all the way into the root. The next is excision surgery, and this is considered the gold standard of endo treatment. This is when a surgeon removes the entire lesion, including what's beneath the surface. So as funny as this sounds, imagine endometriosis is being similar to having weeds in your yard. Ablation would be like taking a weed whacker and chopping the tops off, whereas the root is still intact and in your body. Excision would be like getting a shovel and digging the whole thing out, root included. Success of endosurgeries depends on the extent of endometriosis as well as the skill of the surgeon. Many people have to undergo multiple surgeries as there are a limited number of properly trained endo specialists worldwide. Many surgeons that aren't endo specialists will also perform these surgeries, however they tend to miss the harder to see lesions or they avoid operating on organs they're unfamiliar with, thus not removing all of the disease. So we also need to talk about the effects of endometriosis, and unfortunately it affects nearly all aspects of a person's life. Their ability to reproduce, to work, to go to school, to perform their normal day-to-day activities, as well as relationships with spouses, children, friends, and family. And speaking from both the research and from personal experience, many people dealing with endo develop mental health issues. And unfortunately, new studies have shown that about half of endo sufferers have said that it has led them to having suicidal thoughts at some point. The global study of women's health discovered that people with endo have an average productivity loss of 11 hours a week, which ties into our economy. Endo impacts the economy in ways we don't even realize. The economic burden of endo, taking into account direct costs, such as healthcare, and indirect costs, such as absenteeism, adds up to an estimated $1.8 billion per year in Canada and $119 billion in annual U.S. economic loss. So if this disease affects so many people, why isn't it more well known? Well, to start, various studies estimate that the time to diagnosis is 6 to 10 years, and that's just for a diagnosis, not even treatment. And this is caused by many factors, including normalization of symptoms, which means the idea that women are told that really bad period pain is normal. Well, excruciating pain isn't, and we need to stop normalizing it. There's also the diversity of symptoms, since not everyone experiences endo the same way. And we have severe lacks in funding, research, education, diagnostic methods, and awareness. There's also the fact that talking about your period is still considered taboo and yucky, so a lot of people feel forced into silence. As well, many doctors aren't knowledgeable about endo, and inefficient sex ed programs in schools don't give young girls the information they need to know if something is wrong. And as mentioned earlier, the fact that we don't look sick on the outside. So if you've made it this far, thank you for watching. I really appreciate it, and I'm sure the endo community as a whole does as well. There's a lot to cover with endo, so that means there's a lot I didn't have the time to cover in this video. But hopefully it gave you a nice basic understanding of endometriosis, and hopefully you learned something. And for legality's sake, and to my Eastern European mother's eternal disappointment, I am not a doctor, so none of this should be considered medical advice. But if anything you heard sounds like someone you know, share this video with them. Heck, share it with everybody you know. You have Facebook, Instagram, Twitter, Tinder, Bumble, whatever the kids are doing these days. The whole purpose of me making this video was to educate and increase awareness. So the more people that see it, the better. And if you have endo and you're watching this, regardless of how isolating and unfair this can feel sometimes, know you're not alone. Again, thank you.